MC family planning, and the other thing is the outpatient department. Then this side, the government decided.
If I can just ask you, with FP, is that cycle beads?
Cycle bills is there.
Yeah.
Actually,
SDM, the same days method.
Yes.
We have.
Is it working?
Yeah.
Some people are using it. Actually, it's in my house.
All right. You must start at home, right? Yeah, all change starts at
charity
home.
begins at home.
Unfortunately, at times,
Yes.
when the mother's not there, it's torn.
So this is the government project, a laboratory and the X-ray.
Oh my goodness.
So
X-ray.
in 2002,
Yes.
they were built halfway.
Yes.
There was no more funding.
Yes.
So now, last year we got funding for the laboratory. It's complete, it's working.
What was the cost?
The other one was around 4.5 million.
So that's about what,
That's around $200,000.
$200,000?
No. It's not $100,000. 8 million? No, around $60,000.
$60,000. All right. I need to write that down.
$60,000 is quite a lot of money.
For you.
Yeah, but if it's put in the right place,
Yes.
because this one for us to get funding from the government, it took us a lot of lobbying, using politicians, you know, till we got, because we had a very small lab. The nearest blood bank is in Nairobi.
The nearest blood one.
Yeah, we get the supply of blood from Nairobi or Mombasa. But Mombasa also they get from Nairobi, it's just the south. And because of the HIV prevalence is very low here, and sometimes you get mothers bleeding, that's the main problem.
So you're saying that HIV/AIDS is low here?
It's lower than other regions. It's
Yeah,
there, but
that's-
it's lower.
That's what we were told by USAID.
Yes,
that it's-
it's lower than other parts of Kenya.
Yeah.
So the main challenge we have here is actually blood transfusion
Blood transfusion.
is a challenge. So we rely on rapid tests only. Because a mother is bleeding,
Yes.
you don't have blood.
Okay.
Because, for example, first electricity is less than 1 year. We got it last year.
Yes.
There was no electricity.
There was no.
Then the other thing is transportation of blood.
Oh my goodness, yes.
So actually, we do our own transfusions here.
Okay.
Normally, we prefer the husband, the brothers, to donate blood, and we do the rapid tests. But still, you know, it's still dangerous, and a place whereby HIV prevalence is.
Do you guys do any like an HIV test at all?
We do the rapid. We do HIV.
Okay.
We do brucella. We do hepatitis.
Pertussis?
Hepatitis.
Hepatitis.
Yeah.
And what was the third area you said?
Brucella.
Brucella.
Brucella?
Yeah,
I didn't
brucellosis
know
is
that.
very common here.
Okay. I'm not a doctor.
No
I have no idea.
And I got a question for
I
you.
don't even know how to
Brucellosis is
write
an
it.
infection. Brucellosis is obtained from milk, actually.
Ah.
Yeah, and pasteurized.
Oh, then maybe that's why I don't know. Because,
And I got a
okay.
question for you. For the test, when you
He's the lab in charge. You can ask
The Ijara is
Ah. How do you do, sir?
HIV test, right? Do you have to send it out, or you could do that right there? How long it takes to get the result?
Use the rapid test,
You get rapid test, yeah?
so it takes like 10 minutes.
10 minutes. Do you then? What's the procedure after that? Do you do the second test to confirm it, or you just go with that one?
Yeah, for like blood transfusion, because sometimes we are not able to get blood screened from the regional blood transfusion bank.
Okay.
So we have an emergency, we have to breed and screen here.
Okay.
So we do parallel,
Okay.
or we do serial. Then when we are testing the other grants, there is a algorithm whereby you use the parallel. You do, if it is positive, you confirm with the other one.
Okay.
Like we start with the determine.
Okay.
If it is positive, you go to bioen. If there is a discordance, then now you move to the Unicode.
So how do you, then what's the next procedure after, for example, someone, you find out blood is positive, do you have to do like third round testing, or you have to, what's the procedure after that?
Do you have the antiviral drugs to treat?
Yeah, we have the antiviral and we have a CCC clinic in the OPD department which is running and with the grants. We also have a program whereby they come and like last Saturday they were like last day they were here. We moved like that 20-degree samples. They were sent to Garissa for CD4.
CD4, okay, thank you.
And we are doing creatinine and SGPT.
Okay.
Yeah, here.
That's good. How many
Creatinine we started last week, isn't it?
Yeah.
We never had it
How
before.
many staff or something?
You never had the biochemistry?
No.
The ability
Yeah.
to do
The
that?
ability to do it is when we got the new lab,
Yeah, we
and
started
USA
that.
has been sponsoring. Because creatinine is important for the people taking ARVs.
It is very important. That's how you Another one more question before we actually go to the lab. How many employees in the lab? Just how many people you have working?
Yeah, we are very few. We are only three.
Three.
So when one is on leave, like now, we are left only two. So sometimes we are in great shortage of staff.
And this came from America?
Came from America,
Uh-huh.
but the only problem is the probes are not working. We brought a medical engineer from Amref.
Uh-huh.
He looked at it, he said the machine is good, but these things need to be
So
checked.
it's not usable?
It's not usable. But we wanted this to be the ultrasound room, so that all the mothers who are pregnant can do routine
So,
stuff.
so everything else works except the...
These probes have a problem.
Okay, so you have...
First it was the power,
Uh-huh.
then she brought us the adapter.
Mhm.
It was working, but the probes are not working.
Okay. Has it ever utilized before or never been utilized at all?
This it has been utilized in the American.
Okay, but has it been...
Here
It was
it
used
has-
one, right?
Yes, I used one, but it has not been utilized yet.
And do you have the people training with this yet or no?
The two doctors here can do ultrasound.
Oh, don't,
Yeah, just the basics.
just the basic.
But we were planning when we are, on-job training, when we're using it to train the nurses,
Okay.
so that they can use it. But the problem now, both probes are not actually responding to anything.
Can I actually write down the what? I mean,
Exactly, yeah, sure.
Okay, now who will be doing your translation of this after you guys use?
who will read the
The
human?
radiologists have to read them, right?
I read them myself.
You read them yourself? Are you trained as a radiologist or?
No. You see, in Garissa, when we were doing our training, internship, we were trained for 40 days.
Oh, okay.
Just to do the basic,
Basic stuff.
the fetal heart, the presentation, the kilos, the gestation. But if it's any other specific, we need a radiologist or a radiographer.
Okay.
So to check ultrasound, the
Just
baby,
do the abdominal exam.
is that what I'm saying?
Yeah, take the history.
Nothing to
Nothing
confirm.
No urine test, no nothing?
Urine test, of course, that's the first.
That's the first. But nothing in terms of ultrasound, the baby's
No,
alive or not?
no,
Okay, thank you.
Sometimes it gets complicated whereby now she's bleeding,
Mhm.
the pregnancy test
Yeah.
is positive, but you cannot get the fetal heart. You need an ultrasound. But
We
you have to
actually-
refer all the way to Garissa.
Okay. To get the feeder, okay. Okay, thank you.
So you can see, he's saying there are only two, and they have to fill all these books because everything is manual.
Everything, all the computers that you...
They don't have a computer, but even the government system itself is manual. So they have to record everywhere. Imagine how many books for one person to see one patient.
Wow. So no computer in the lab?
Yeah.
So you do,
Personnel is
Even the staff.
Is there particular, if we were to, it seems to me that computers these days are the easiest things to get.
Yes.
So what is the problem? What is the systematic problem? What is the systemic
The
problem?
system is, the data is not, they have not actually done automation. So they have to fill manually.
But to my mind, in today's world, computers are easy.
They're
Yeah.
easy, but you know, a government protocol will take a long time to
That's
implement.
what I was getting at.
Exactly.
So is this the same situation for just about any hospital?
No.
Yes.
Is it just
In
this
the
part of the
laboratory,
country, or is it?
If, for example, we set up a system whereby we can link, then we can send our data as a soft copy.
Yes.
But the problem is now he has to sit down and count this month how many cases of malaria have I seen, how many full hemograms,
Yes.
anemias are there, manually.
Yeah.
Because even, you know, we need that, it should come from the ministry actually, automation. But now some hospitals have implemented, like hospitals like Kenyatta National Hospital, is fully automated, whereby everything is recorded in the computer and you can get it in any department.
Yes.
Yeah. But in this region, we are far from that.
Good question. What are the rate of the malaria here?
This region is considered as a low prevalence,
Low prevalence, yeah?
but it's very high.
Even though it's considered low prevalence, it's very high.
Actually, the government is the one which considered it, but according to the cases, the amount of cases we have
Yeah.
is very, very high because one, we have a very big river,
Because of the river,
yeah, and the area is bushy.
every pushing.
Yes. So the
Because they
prevalence
told
is
us
very
when
high.
we asked the U.S. Embassy, they said it's considered low grade.
That's what the government thinks,
Yeah,
but the prevalence is high according to our experience here.
okay.
Does that mean that you get less funding?
For malaria?
Okay, malaria, HIV programs, TB programs, those ones I can say they're well funded because the drugs are free. Okay, and you know the test done, for example, the sputum for TB, we do it free of charge for patients.
For TB?
Yeah.
For TB?
But now the supply from the government is very poor. For example, for you to do a malaria diagnosis, you need to have a slide.
Slide,
The government will never provide that slide. So you have to charge a patient 30 shillings to do a malaria test so that you can have circulation of those slides.
And if we were to provide things, very specific things, like 1,000 slides, I mean, I'm trying to understand
Let me tell you from our experience, a very simple thing like a microscope.
Yes.
He's a person who has been struggling because a microscope costs around $1,000, isn't it? Washira?
Oh, I feel so bad, I
Yeah.
couldn't fit one. I had one for you and I couldn't fit it in my bag.
It's even less than
I'm so sorry.
Yeah. So he has to struggle. If you the microscope actually it was repaired 2 weeks ago from a
And that's
family
only one.
engineer. For this lab is the only one because it's the only good one. We get some microscope, but when they use for 6 months, then you know they don't work so well. So this is the only microscope we have here for the malaria, any other test.
Okay.
So
And this came from where?
this
GOK MOH. You see,
from the government.
Yeah.
Government of Kenya, Ministry of Health.
Ah, okay.
Government of Kenya.
Now on this back here, I see USAID. Is that
This is from
Althea Plus or
USAID
Althea?
and the biochemistry and the hematology machine. They were donated for HIV patients. And that's what Afia 2 was about.
Exactly.
So, question, actually, this will be the last one. We actually have we have a doctor, actually a PhD holder who's expert for malaria, testing, and that's the guy who wrote those questions for microbiology.
Yes.
It's interesting.
Mhm.
He came up with the rapid testing, which is a urine test. Instead of doing like, blood test,
Yes.
he came up actually a device, a diagnostic test of urine test.
Mhm.
And he's interested in public health. He wants to come to this area and explore more. But what I will do, actually, I'll try to connect with you email-wise.
Yes.
So you could talk to him one-to-one and, pretty much talk to him about, what are the need in the lab, what do you need, all that stuff. So we can proceed if you don't mind.
Yeah.
Okay.
This is the rapid HP.
Thank you.
So we're supposed